guys, let's talk about needed nutrients. I'm going to go through this fairly quickly. So there are 4 factors that determine our need for nutrients: our diet, our disease states, our lifestyle, and medications. Now, this is the percent of population not meeting the estimated average requirement or the adequate intake for vitamins and minerals. This is data from 2007 to 2010 NHANES. And there are basically 9 missing nutrients: potassium, vitamin D, choline, vitamin E, vitamin K, magnesium, calcium, vitamin A, and vitamin C. Now, NHANES didn't have data for manganese, but I'm willing to bet that it's deficient as well. And then according to NHANES, we're doing okay, where only 10% or less of the population is not hitting the estimated average requirement for iron, zinc, copper, selenium, phosphorus, sodium, and the B vitamins. But I'm going to show you why that actually is an issue moving forward. Now, even if you take a multivitamin or mineral, which 1 out of 2 adults in the United States are taking, you're still missing the exact same 9 nutrients. They're just not as prevalent. And the reason why is because most of our diet is primarily made up of grains, sugars, fats, and oils, so they're devoid of these nutrients. And even the grains that we're consuming now are refined. 94% of the grains we consume are no longer unrefined traditional whole grains. They have been refined through a steel roller mill and have lost more than 80% of their vitamin E, vitamin B6, potassium, that's vitamin K, and magnesium. Over here, you can see that there's been 75% reduction in fiber, 71% loss of potassium, 56% loss in calcium, and 45% loss in selenium. So the grains that we are eating are now depleted in nutrients. And the problem is the nutrients they're depleted in, they're not added back. So we fortify enriched wheat with B1, B2, B3, iron, and folate. So we're not putting back the nutrients that have been depleted in grains. Now, if you look at sugar, the average adult in the United States is consuming around 120 pounds of sugar per person per year, and children are consuming twice that. So children are consuming twice their weight in sugar per year. And that's an issue because that will deplete our nutrition. Sugar isn't just calories without nutrients. Sugar taxes our B vitamins. Sugar leads to high insulin levels, which causes magnesium loss in the urine. Sugar can lead to insulin resistance, which reduces our ability to drive magnesium and potassium into the cell. And fructose, which makes up half of sugar, can reduce the absorption of copper in the intestine and reduces copper status in animals. So basically, eating high amounts of sugar can increase the need for magnesium, copper, and B vitamins. And these nutrients are not added back to the diet. There's also an issue of vanishing nutrients from our current food supply compared to, let's say, 70 years ago. So this study, this was looking at 50 to 70 year mineral depletion in our food. And you can see here that copper has been depleted the most. And it's across the board: vegetables, fruits, meat, cheeses, and dairy. And if you look at copper, 76% of our vegetables, we've lost 76% of the copper. We've lost over half the copper in our meat compared to 50 to 70 years ago. Cheese and dairy has lost basically all of its copper. And you can see too, iron has lost a lot as well across the board, as has calcium, as has magnesium. So if you look for magnesium, the primary foods that have been depleted: vegetables, fruits, meat, cheeses. So about 20%. We've lost about 20% of the magnesium from our food compared to 1940. We've lost about 50 to 75%, and in some cases even 90% of copper. So based on this data, we would say we have 5 missing minerals in the diet, copper being 1, then iron, calcium, magnesium, and potassium. Now, if you look at mineral reductions in wheat, this is from the UK, this is basically spanning 160 years, there have been a 33% reduction in copper and magnesium, 25% reduction in iron, and a 38% reduction in zinc. And this is because if you look at the use of chemical fertilizers, which is right here with the squares, you can see that as we use this chemical fertilizer, the nutrients go down. Whereas if you look at farmyard manure, right here, the line goes up a little bit. So you can see that these chemical fertilizers are causing reductions in iron and zinc and copper and all these things, whereas using farmyard manure actually increases these a little bit. So the switch from using traditional farming methods to chemical fertilizers is depleting nutrients in our food supply. So now we can say we have 6 missing minerals because we've added zinc now with this study. There's a 38% loss in zinc since 1840 in wheat. If we look at phosphorus fertilization, you can see here that there's been a 30% reduction in calcium and magnesium when you use phosphorus fertilization in red raspberries. And as the parts per million go up, added to the soil, calcium and magnesium go down. And then you can see really dramatic reductions in copper and boron and zinc with the use of phosphorus fertilization. So we lose more than half of the copper, we lose about 30% of boron and about 30% of zinc when we use these phosphorus fertilizers. So now we have 7 missing minerals in the diet, right, with this raspberry phosphorus fertilizer study. We can add in boron now as well as a missing nutrient. Now this study is wheat seed micronutrient contents spanning 80 years, and you can see reductions in iron of 24%, zinc anywhere from 11 to 31%, and selenium 16%. So now we can add selenium as a missing mineral in the diet. And then this is a study looking at over 50 years what's happened to 43 garden crops in the United States, and you can see here riboflavin or vitamin B2 has gone down by 38% and vitamin C by 20%. So we have 10 missing nutrients in the diet now, adding vitamin C and B2. This study was mineral concentration of broccoli florets in relation to year of cultivar, and you can see since 1945 there's been a 27% drop in manganese in broccoli florets. So 11 vanishing nutrients in our food. 50 years of nutrient depletions in our food have caused these nutrients to vanish from our food supply. Elevated CO2 levels also reduce the nutrient concentration of our food. So you can see here with rice, and this is projected to occur at the end of the century, we're going to lose about 8% of iron, 5% of zinc, and you're looking at 10 to 20% reductions in B vitamins and 30% reductions in folate, vitamin B9. And you can see here too, 8% drop in minerals as well with elevations in CO2. And you can see all these minerals that become depleted, right? Phosphorus, calcium, selenium, potassium, magnesium, iron, zinc, and copper, and a little bit of manganese as well. So our whole foods today are less nutritious than they were 50 to 100 years ago. We have to eat around 30% more food to obtain the same level of nutrients as we did 100 years ago. And this could rise to almost 40% with rising CO2 levels. So you have here, again, remember these missing nutrients from before, these 9? Well, you have these 11 now that are being depleted in our food supply. So even though we aren't getting these nutrients from our diet, the other nutrients that we thought we were doing good on are vanishing from our food supply. And increasing CO2, I've added the B vitamin reductions as well. So take-home message, around 1 out of 3 or more Americans are not getting the estimated average requirement for 9 vital nutrients. That would be vitamin A, E, D, K, potassium, choline, magnesium, calcium, and vitamin C. This still applies even if you take a multivitamin and mineral. The 10th nutrient lacking, most likely being manganese. The other nutrients that we thought we were doing okay on, that we thought 90% of Americans were getting the estimated average requirement, is now vanishing from our food supply. In other words, all essential vitamins and minerals appear to be lacking in the American diet. Now, what makes up the majority of the U.S. diet? Well, what aren't we eating? We're not eating vegetables, we're not eating nuts, we're not eating beans, we're not eating eggs, right? And we're not replacing the lost vitamin E, K, B6, copper, magnesium, potassium, folate, and lutein, and zeaxanthin, and choline, right? Because we don't eat a lot of eggs or greens, which contains those lutein and zeaxanthin, carotenoids, which are important for eye health, and choline, which is found in eggs, which is very important for liver health. And you can see here, 2 eggs may not have a lot of lutein and zeaxanthin compared to spinach and kale, but it is more bioavailable. Now, if we look at optimal intakes just versus, we were just talking about, Americans not hitting their average requirements, you can see here that the recommended dietary intake is about 3 times lower than what an optimal intake for vitamin C would be. And this level is seems to basically give us optimal neutrophil activity and cytotoxicity at around 250 milligrams or more. I mean, we don't even saturate our vitamin C enzymes till we consume about 120 milligrams of vitamin C per day. And it can take up to 200 milligrams to saturate our white blood cells. And they're the first tissues that will actually saturate vitamin C. So, 100 to 200 milligrams saturating the white blood cells, your muscle will continue to go up, your skeletal muscle, vitamin C, well beyond 250 milligrams. And there's clinical studies showing that 500 milligrams of vitamin C versus 50 milligrams of vitamin C cuts the risk of getting 3 or more colds per year by 67%. So 500 milligrams per day of vitamin C is probably more optimal than 50, at least based on the clinical studies in humans. For copper, the recommended dietary intake is 0.9 milligrams, but optimal, based on the studies I've looked at, and I have a few review papers on this, is probably at least 2 milligrams, but potentially up to 6 milligrams per day. Same with vitamin K1. The adequate intake is only 100 micrograms, but optimal may be greater than or equal to 500 micrograms. And then for lutein and zeaxanthin, based on the studies as well, we don't have recommended dietary intake, but anywhere from 5 to 12 milligrams is likely optimal. So concluding remarks, again, the Western diet is lacking many vitamins and minerals. Even if the population increases the consumption of whole, unprocessed foods, if we're eating it from non-traditional farming methods, we're going to have to probably consume 30% more food just to get the same nutrients as we did 50 to 100 years ago. So eating real food may no longer be enough unless it's from traditional farming methods. We need to focus on growing more nutrient-dense food, stop growing for yield, basically more biodynamic farming, right? Composting, lack of chemical fertilizers, using more traditional farming methods. The recommended dietary allowance is not the optimal intake, and the optimal intake is almost always above the estimated average requirement or the recommended dietary allowance. Optimal intake for treating a disease is going to be greater than for prevention as well. So quickly, I'm going to go over the disease states that can increase our nutrient needs. Again, 75% of U.S. adults have insulin resistance or high insulin levels, which can increase magnesium loss in the urine and prevent magnesium from getting into the cell. Gastrointestinal disorders like celiac, Crohn's, ulcerative colitis, and bariatric surgery can lead to reduced absorption of copper, zinc, magnesium, and vitamin B12. And then inflammation or endotoxemia can lead to losses in vitamin C, vitamin E, glycine, cysteine, glutamate, so reductions in glutathione, and riboflavin. Liver disease can reduce copper, iron, and magnesium. Kidney disease, so many of these minerals and even vitamins are bound to albumin. So if we spill albumin out in the urine because we have kidney damage, which many type 2 diabetics have micro or macroalbuminuria, they will lose copper, zinc, magnesium, and vitamin B6. Also, lifestyle affects mineral loss. Sweating in the sauna, steam bath, living in hot climates, we lose anywhere from a half to a full teaspoon of salt per hour of exercise. We also lose 50 to 100 micrograms of iodine per hour, and we lose anywhere from 0.25 to 1 milligram of copper per hour of exercise through sweat, and we also lose about 20 micrograms of copper per hour of exercise, either through sweating, or we have basically a doubling of chromium loss in the urine when we exercise, and we have a tripling of chromium loss in the urine when we increase our sugar intake. And then caffeine, coffee, energy drinks, we can cause a tremendous salt loss. 4 cups of coffee leads to approximately a half a teaspoon of salt loss in the urine. So again, we thought we were okay with the B vitamins and copper, but we thought wrong. Plasma B12, this is from Framingham Offspring, and 3,000 patients in the U.S. They had their B12 levels measured. Almost 40% had plasma vitamin B12 concentrations that could lead to deficiency problems, and 17% had very low levels. So nearly 40%, or 4 out of 10 people in the U.S. may have marginal B12 deficiency. Large deficiencies in B vitamins in vegetarians and non-vegetarians. So if you look here, B2 is a problem in about 1 out of 4 vegetarians and about 1 out of 5 non-vegetarians. And you can see too, in vegetarians, B6 is an issue as well. So 1 out of 4 vegetarians and non-vegetarians are B2 deficient. So B2 is an issue. Riboflavin is another name for vitamin B2. Copper deficiency. Just now looking at serum levels, you're already really deficient if your serum levels of copper are low. And copper is actually an acute phase reactant, so typically we see elevated levels of copper in inflammatory states. So to have low levels, these people are really deficient. And if we look, one study in over 300 young Australian women showed about 1 out of 4 having low copper levels. And if you're a morbidly obese person prior to bariatric surgery, and bariatric surgery is a very big risk factor for causing copper deficiency, and this was prior. You're looking at 2 out of 3 morbidly obese women being deficient in copper based on serum levels. Magnesium deficiency, if you're looking at blood levels, about 10 to 30% have marginal magnesium deficiency. When you do more invasive treatments or looking at using the IV magnesium load test, you're going to see more people have magnesium deficiency. And that's the gold standard for measuring magnesium deficiency is the IV magnesium load test. And patients with high blood pressure, 50% are magnesium deficient. 80% become deficient when they're treated over 6 months because thiazide diuretics can deplete the body of magnesium, which is why they are associated with low potassium levels. They're actually depleting magnesium. Loop diuretics seem to also deplete magnesium and then potassium. Patients with heart disease, about 50% are magnesium deficient. Same with patients with GI issues or alcoholism. 65% of people in the ICU will be magnesium deficient, and then the largest population who has the greatest frequency of magnesium deficiency is postmenopausal osteoporotic women. Greater than 80% will be magnesium deficient. Again, why is magnesium deficiency so prevalent? There's been a loss of magnesium in our food supply, right? Our bacon's down 18%, cheddar cheese is down 38%, Parmesan cheese 70%. Vegetables have lost a quarter of their magnesium. The refining process, as we refine grains, we basically lose all the magnesium, right? Flour has lost 82%, polished rice 83%, starch 97%, and white sugar 99%. Since 1968, the magnesium content in wheat itself has dropped 20%. That's prior to actually, using a mill and refining it. So just the magnesium itself in our food supply is down. Over 60 factors cause magnesium depletion. I'm going to go over some of those. I would highly recommend looking up our subclinical magnesium deficiency as a primary driver of cardiovascular disease and a public health crisis. We published that in BMJ Open Heart a couple of years ago. It's got about 250 references. But basically our diet, right? High in fat, sugar, alcohol, devoid of magnesium. Fats and sugars deplete the body of magnesium, so fat can reduce the absorption of magnesium, and sugar obviously can increase the spill of magnesium in the urine and prevent it from getting into the cell. Calcium fortifications, our diets are too high in calcium and phosphorus now because of what's been added. Phosphorus is added as well. These inorganic phosphates are added to a lot of things. If you look at inactive ingredients and you see sodium phosphate, that is an added inorganic phosphorus. Exercise depleting sodium, and then that can lead to magnesium depletion. Gastrointestinal disorders, we don't absorb magnesium as well when we have these type of disorders, or we get bariatric surgery. Stress, noradrenaline release and the activation of the sympathetic nervous system causes increased loss of magnesium in the urine. And then medications, diuretics, antacids, other acid-suppressing medications like proton pump inhibitors, Zantac and Pepsid. We need good stomach acid to digest our food and absorb magnesium, B12, calcium, zinc, things like that. Other factors that can cause magnesium depletion are B6 or selenium deficiency, which we need B6 to absorb and drive magnesium into the cell, and selenium deficiency can also lead to magnesium deficiency. Too much vitamin D or lack of vitamin D can cause magnesium deficiency. And then we talked a little bit about liver diseases, right? Liver produces albumin, and albumin binds magnesium. So we won't be able to export magnesium or move it around as well. And we have, fatty liver disease, which about 30 to 40% of U.S. adults have. Metabolic acidosis, pancreatitis, cancer, and hyperinsulinemia. This is the biggest driver of magnesium depletion in our population. Drug nutrient depletion, acid-suppressing medications, again, we covered that. Anti-anxiety medications like benzodiazepines, right, Xanax, that can lead to vitamin D and calcium deficiency. Antipsychotics, can lead to vitamin B2 deficiency, and birth control can cause folic acid, magnesium, B6 deficiency, but there's some other things as well. It can probably cause loss of taurine, other B vitamins as well. Last slide here, ACE inhibitors can cause reductions in zinc, diuretics can deplete us of magnesium, potassium, B1, and zinc, and metformin can cause B12 and folic acid loss, and statins can cause us to lose CoQ10. All right, guys, I hope that was helpful. We're going to close this out now.